The question, is it true that the major cause of fibromyalgia is brain function dysfunction? Fibromyalgia is a syndrome of unknown causes that results in lasting, sometimes debilitating, muscle pain and fatigue. Fibromyalgia is also known as fibrositis or fibromyositis, pain. The primary symptom of fibromyalgia is pain. The pain can be in one place or all over the body. The exact locations of the pain are called tender points. Fibromyalgia pain is often described as video, how to reverse fibromyalgia now. Many experts believe that fibromyalgia is not a disease, but is rather a chronic pain condition brought on by several abnormal body responses to stress. Areas in the brain that are responsible for the sensation of pain react differently in fibromyalgia patients than the same areas in healthy people. A conflict between sensory perception and nervous system processing might occur in people with fibromyalgia. Fibromyalgia patients have been found to have greater awareness of, or less tolerance for, movement problems, such as tremor, that don't match with their expected sensory feedback. This mismatch in sensory signals might enhance the perception of pain. Fibromyalgia patients also seem to be more sensitive to sounds. Fibromyalgia has symptoms that resemble those of some rheumatic illnesses, including rheumatoid arthritis and lupus, systemic lupus erythematosus. These are autoimmune diseases in which a defective immune system mistakenly attacks the body's own healthy tissue, producing inflammation and damage. The pain in fibromyalgia, however, does not appear to be due to autoimmune factors, and there is little evidence to support a role for an inflammatory response in fibromyalgia. Studies report a higher incidence of fibromyalgia among family members. It is not clear whether genetic or psychological factors, or both, are involved. Studies have found that detection of other causes of symptoms. A healthcare provider will also examine the nails, skin, mucous membranes, joints, spine, muscles, and bones to help rule out arthritis, thyroid disease, and other disorders. Multiple chemical sensitivity. Multiple chemical sensitivity, MCS, is a term that describes conditions in which certain chemicals cause symptoms similar to CFS or fibromyalgia. As with CFS and fibromyalgia, some experts are uncertain whether MCS is a medical problem or psychologically based condition. Because everyone is exposed to many chemicals on a daily basis, it is very difficult to determine whether chemicals are responsible for specific symptoms. Restless leg syndrome. About 15% of people with fibromyalgia have restless leg syndrome. Restless leg syndrome is an unsettling and poorly understood movement disorder that is sometimes described as a sense of unease and weariness in the lower leg that is aggravated by rest and relieved by movement. Fibromyalgia can be mild or disabling, and the emotional toll can be substantial. People with fibromyalgia experience greater psychological distress and a greater impact on quality of life than those with other conditions, such as chronic low back pain. About half of all patients have difficulty with routine daily activities, or are unable to perform them. An estimated 30 to 40% of patients have had to quit work or change jobs. Patients with either CFS or fibromyalgia are more likely to lose jobs, possessions, and support from friends and family than are people suffering from other conditions that cause fatigue. Outlook in children. Children with fibromyalgia tend to have a better outlook than adults with the disorder. Several studies have reported that more than half of children with fibromyalgia recover in 2 to 3 years. Check out the link below for a guide on long-term remission or to join in with the community.